Good afternoon. My name is Dr. Aaron French. I'm a Canadian chiropractor who graduated from the Canadian Memorial Chiropractic College in 1999. I practice in Canada, Mexico, and most recently in Colombia. Today we'll be talking about linking patient symptoms and physiology with their spinal joint dysfunction. Now, as you're probably aware, there are a number of causes of spinal pain, whether it be in the neck, the mid-back, or lower back and pelvis. The most common cause of pain in these areas is actually muscle-related, i.e. muscle strain. For example, a pulled muscle, a contusion, or simple soreness from overexertion, such as going to the gym and working out too hard. Muscle strains generate diffuse, achy pain, usually at or near the injury, although sometimes they cause referral pain immediately above or below the injury. Muscle strains often lead to tight muscle fibers or bands that can be easily palpated as trigger points. Tight muscles lead to reduced range of motion and usually less strength in the muscle. As a muscle strain contracts, it can certainly affect related joints and nerves, so you shouldn't think of any injury in complete isolation. Many different tissues are usually involved in each and every injury. However, mild to moderate muscle strains usually resolve after a few days, and the symptoms quickly disappear soon thereafter. Stretching, massage, light exercise, cryotherapy, which is the application of ice, and non-steroidal anti-inflammatory drugs, abbreviated as NSAIDs, can all be helpful for muscle strains, but they often resolve without any specific treatment at all. Now, joint dysfunction is the next most common cause of spinal pain in the neck, mid-back, and low back areas. In contrast to muscle strains, joint sprains, or subluxations, typically are more painful and often described as generating sharp or stabbing type of pain, particularly with movement. Referral pain is common and can occur further away from the injury site. And in addition to reduced range of motion due to joint dysfunction, there is usually a noticeable change in posture. For example, dysfunction in a facet joint of the lumbar spine often causes a stooped over posture with some lateral flexion. This is called an antalgic posture from pain. Basically, if the facet joint is jammed or subluxated, the body may attempt to open up the joint with forward and lateral flexion, which takes the pressure off the nerve-rich joint capsule. Let's demonstrate that on the model here. Let's say, for example, a person is suffering from a right L5 facet problem. What I'm saying here is the body might automatically try to laterally flex away from the injury and forward flex in efforts to create more space in this joint, taking the pressure off the nerves. Now, in other cases, subluxation of the facet joint may cause strong enough muscle spasm to pull the torso towards the site of injury. In that case, if we have our L5 facet problem, maybe the paraspinal muscles or the quadratus lumborum muscle will spasm in an attempt to guard the injury. Therefore, the spine will be laterally flexed towards the injury and a little bit forward. Now, spinal range of motion in generally is more affected with joint dysfunction than with muscle strains. For example, cervical facet dysfunction often reduces range of motion in the neck by 50% or greater, particularly with rotation and extension. In contrast, muscle pulls can limit movement, but not nearly to the extent of a joint sprain or subluxation. Now, before we look at more specific examples of spinal joint dysfunction, let's better understand the word subluxation. According to the World Health Organization, or WHO, a subluxation is a lesion or dysfunction in a joint or motion segment in which alignment, movement integrity, and or physiological function are altered, although contact between joint surfaces remains intact. So it's not a frank dislocation, but a more subtle misalignment. In general, a subluxation is an abnormal change in a joint's positioning, movement, and related nerve function, which can affect soft tissues, bones, and also the internal organs. The entire range of possible effects or symptoms is called the vertebral subluxation complex, which has been a controversial concept since it was envisioned about 125 years ago by D.D. Palmer, who is the founder of the modern-day chiropractic profession. But that is a topic for another lecture. Let's continue on with what causes subluxations, which is a good question. The most common causes of subluxations are trauma, either macro trauma, like from a car accident and a whiplash injury, or from micro trauma, perhaps a minor slip and fall. They're also caused by overuse syndromes, chronically poor posture, and degenerative changes in joints, such as osteoarthritis, which is the wear and tear type of arthritis. Osteoarthritis impacts vertebral discs by reducing their height and ability to cushion impact. Reduced disc height then affects spinal facet joints secondarily. Subluxation of spinal joints, which are called facet joints, as we noted earlier, not only typically leads to localized sharp-type pain generated from the joint capsule fibers, it can also irritate, either chemically or physically, the nerve roots that exit the spinal cord through the intervertebral foramina. Irritation of the nerve roots often leads to radiculopathy, which is a shooting and or burning pain along the course of the nerve, usually accompanied by numbness, tingling, or weakness in the lower extremities. Now, radiculopathy can occur in any part of the spine, but it's most common in the lower back and lower portion of the neck. So as we can see in summary here on the poster, if the cause of the spinal pain is primarily in the joint, the facet joints, for example, of the spine, the primary symptoms will be reduced range of motion, sharp, stabbing type of pain, especially with movement, and also antalgia, or an antalgic posture due to the pain, which for the low back would be maybe stooped forward and a little bit crinked to the side. However, it's possible even when the joint is the primary cause of the problem, you might get some secondary muscle involvement, such as trigger point formation, maybe in the paraspinal muscles, for example. Maybe some of the pain might be better described as soreness or an achy type of pain. And maybe some of the related muscles, such as the paraspinal muscles, might have some weakness in them. The same holds true for nerve involvement. Even if the primary injury or problem is joint related, you might get some nerve issues secondarily. Perhaps there might be some radiculopathy down the arms or down the legs. Perhaps some of the pain may be better described as burning or electric type of pain. And perhaps in the lower legs or feet or lower arms or hands, there might be some numbness and tingling. The take-home point is that there's never such thing as a pure joint injury. There's going to be some secondary muscle and nerve involvement. The same holds true if the injury is primarily muscular in nature. You'd get some secondary joint and nerve involvement. Okay? So that's the take-home point. No injury occurs in complete isolation. Now, let's take a look at some examples of spinal joint dysfunction, for example, in the neck and the low back. Let's start with cervical joint dysfunction. Common causes include a whiplash-type injury from a motor vehicle accident or perhaps sports trauma, chronically poor posture caused by excessive computer use or texting, which of course is epidemic in today's world, perhaps also stomach sleeping, overuse situations, maybe being a welder with a heavy helmet constantly flicking the helmet up and down, maybe a house painter, painting ceilings and constantly looking up, and also the onset of degenerative conditions, such as osteoarthritis or rheumatoid arthritis. Keep in mind that degenerative changes in neck joints are often precipitated by trauma, such as whiplash, that goes untreated. Now, common areas affected, whiplash type injuries typically affect the lower portion of the cervical spine, such as C5, 6, and 7. Chronically poor posture and overuse syndromes can affect any part of the neck, including the upper portions, C1, 2, and 3. If the lower part of the cervical spine is affected, expect reduced range of motion, mainly with neck flexion and extension, but also partially lateral flexion will be reduced. Sharp stabbing type pain would be felt in the lower neck area near the facet joints and triggered with movement, particularly extension, as you're jamming the joint. Dysfunctional cervical facet joints can also generate referral pain into the shoulder blade, or sometimes even the mid-back. Neck muscles attached in the lower cervical spine, such as the scalenes, levator scapulae, and the SCM in this area, might feel tight and contracted and generate a bit of soreness. Radiculopathy, if present, would affect the distal arm and hands, maybe some shooting or burning pain with numbness or pins and needles in the hands. And the antalgic posture would involve a crooked or crooked looking neck with some lateral flexion, maybe some rotation. If the upper part of the cervical spine is affected, expect reduced range of motion, mainly with neck rotation, but partially also with lateral flexion. Sharp stabbing pain would be felt in the upper neck near the facet joints and triggered with rotation and extension. Neck muscles attached in the upper cervical spine, such as the suboccipitals, might feel tight and generate trigger points. Radiculopathy, if present, would affect the occipital part of the cranium, which is the rear of the skull. Both suboccipital trigger points via referral pain and radiculopathy can cause dull headaches, referred to as cervicogenic headaches. Now, how about lumbar joint dysfunction in the low back? Common causes include trauma from heavy lifting without using the legs properly, compressive type injuries such as falling off a ladder or falling off a roof, a direct impact type of injury such as being tackled in football, chronically poor posture caused by excessive sitting, slouching, or stomach sleeping in the bed at night, overuse situation caused by manual labor with lots of lifting and twisting is another cause, and also the onset of degenerative conditions such as osteoarthritis or rheumatoid arthritis. Common areas affected. Most lumbar back pain is caused by joint or disc dysfunction at the L4-L5 segment because of all the pressure or weight from the upper body and torso going through that segment, although the L5-S1 segment underneath is susceptible also. If the lower part of the lumbar spine is affected, expect reduced range of motion, mainly with low back extension and flexion, but also less rotation also. Sharp stabbing pain could be felt in the lower back near the facet joints and triggered with movement. Dysfunctional lumbar facet joints can also generate referral pain into the flanks of the side, the buttocks, and also the hamstring muscles. Muscles attached in the lower lumbar spine, such as the paraspinals and quadratus lumborum muscles, might feel tight as if they're guarding, and they may generate some soreness also. Radiculopathy, if present, would affect the legs and feet. Perhaps you feel some shooting and burning pain with numbness or pins or needles in the feet. And this is typically called sciatica due to sciatic nerve involvement. Although keep in mind that radiculopathy is more often caused by spinal disc herniation with no facet involvement. Antalgic posture with lumbar joint dysfunction would involve being bent forward and off to one side. Now, in terms of orthopedic testing, Kemp's test is the most used to see if the cervical or lumbar facet joints are dysfunctional and or inflamed. Kemp's test involves axial pressure coming from above with some extension and rotation of the spine. To rule out a disc herniation, which can be confused with radiculopathy caused by spinal joint dysfunction, certain orthopedic tests can be used, such as Valsalva's, where you blow down and increase internal pressure, but also Sperling's, cervical flexion, the Soto-Hall test, and of course the straight leg raise testing for a low back herniation. Now let's talk a little bit about a clinical perspective. When you're seeing symptomatic patients in a clinical setting, most are there because the spinal issue is primarily one of joint and or nerve dysfunction, okay, and not just a muscle strain. Now why is that? It's because most people don't seek medical help or advice right away when they experience mild to moderate musculoskeletal pain. Most people wait for a few days or perhaps even a few weeks, and this is usually enough time for muscle strains to heal or get significantly better. In contrast now, joint and or nerve dysfunction generates more pain, sometimes very severe, and often lasts much longer, sometimes becoming chronic if no treatment is sought. Now, surrounding muscles may invariably be involved with spinal joint dysfunction, and the related nerve roots may not be all that happy either. But always assume that the joints are a significant part of the problem and must be addressed. For most causes of spinal joint dysfunction, chiropractic spinal manipulation is not only appropriate, but it's effective and safe, which is good news being chiropractors. Some causes, such as a herniated disc, not just a disc bulge, but an actual herniated disc, or inflammatory arthritis, such as rheumatoid arthritis, are not typically appropriate for adjusting, however. Adjunctive therapies include electronic muscle stimulation, ultrasound, deep tissue massage, perhaps acupuncture, which is called dry needling, or the more invasive procedure of facet joint injections. Now here's a question for you. How many chiropractic adjustments are needed for spinal joint dysfunction? That's the million-dollar question. Now it's dependent on many factors, including the various chiropractic techniques. But if the spinal facet joints are the primary cause of pain, then in my clinical opinion, somewhere between 1 and 6 adjustments, okay, specifically ones that target the facet joints, as is the case with diversified adjusting techniques, these should at least make a positive impact in terms of less pain, increased range of motion, and reduced muscle spasm or tightness. If absolutely no progress is made within 6 or half a dozen treatments, or if the patient gets worse, then another form of treatment should be sought. But to be clear, sometimes only one single chiropractic adjustment is enough to completely resolve an acute spinal dysfunction. And sometimes it may take a dozen or more treatments to completely resolve a patient's chronic issue. But in my opinion, a half dozen sessions spread out over a few weeks, perhaps 2 weeks, is a good guideline to expect both objective and subjective progress if your diagnosis is correct. Okay, this concludes my presentation, so thank you for your time and attention, and until next time, stay healthy and happy. Thank you.